The medical torture of the Middle Ages. Imagine you are sick. Imagine you are in pain. In our world, you call a doctor. You go to a hospital. You expect science, sanitation, and a chance at healing. Now, I want you to forget all of that. I want you to imagine a world where the doctor is more terrifying than the disease. A world where the hospital is not a place of healing, but a waiting room for the grave. A world where the cure is a form of torture so brutal, it would make a modern-day sadist sick to their stomach. You are about to discover the story that history books are too squeamish to tell you. This is not the story of medicine. This is a story of a 1,000-year nightmare, where good intentions, profound ignorance, and a belief in magic created one of the most horrifying systems of human suffering ever conceived. This is the truth about medieval medicine. To understand the horror, you must first understand the insanity of the theory it was all based on. For over 1,000 years, doctors believed that the human body was controlled by 4 liquids, or humors: blood, phlegm, yellow bile, and black bile. They believed that all sickness, from a common cold to the bubonic plague, was caused by an imbalance of these 4 liquids. And the only way to cure you was to rebalance them. How? By getting them out of you. This single, catastrophically wrong idea was the foundation for centuries of medical torture. It wasn't about killing germs. They didn't know what those were. It wasn't about setting bone correctly. It was about draining, purging, and bleeding you, often until you died from the cure itself. If you had a fever, it meant you had too much blood, so they would bleed you. If you had a cough, too much phlegm, so they would make you vomit. If you were depressed, too much black bile, so they would give you laxatives so powerful they could liquefy your insides. Every single cure was a direct, physical assault on your already weakened body, all based on a theory that was completely, utterly wrong. Let's talk about the single most common medical procedure of the Middle Ages: bloodletting. This was the universal cure-all. Got a headache? Let's bleed you. Feeling sad? Let's bleed you. Have the plague? Let's bleed you. And how did they do it? There were 2 popular methods. The first was venesection. This is what you imagine. The doctor, or more often, the barber surgeon, yes, your barber was your surgeon, would take a special knife called phlegm, place it over a vein in your arm, and give it a sharp tap with a small wooden stick. The goal was to open the vein and drain a prescribed amount of blood into a bowl. But these were not sterile environments. The phlegms were dirty. The bowls were dirty. The surgeon's hands were dirty. Massive, life-threatening infections were not a risk. They were a near certainty. But it gets worse. What if they couldn't find a good vein? Then they would turn to the second method: leeches. They would place these blood-sucking creatures all over your body and let them gorge themselves. But sometimes, the leeches would get lost. There are horrifying medical records of doctors having to retrieve leeches from inside a patient's nose, ears, or other orifices. The most insane part? They had detailed charts showing which part of the body to bleed for which ailment, all based on the position of the stars and the planets. Your medical treatment was not based on science. It was based on astrology. You could die from a simple infection because the doctor decided to bleed your left leg instead of your right, because Saturn was in the wrong house. If bloodletting was the most common horror, surgery was the most spectacular. For the entire medieval period, there was no effective anesthetic. The only thing they had was alcohol and a prayer that you would pass out from pain. You were awake for everything. Imagine you have a broken leg. The barber surgeon, likely half-drunk to steady his own nose, would have several large men hold you down on a wooden table. He would take a saw, the same kind a carpenter would use to cut wood, and begin to saw through your leg. There was no sanitation. The saws were caked with the blood and bone fragments of previous patients. The goal was not precision. It was speed. A good surgeon was one who could amputate a leg in under a minute, while you screamed and thrashed and prayed for the darkness to take you. And what about after? How did they stop the bleeding? They would take a red-hot iron poker from a fire and press it directly into your open wound, cauterizing the flesh. The smell of your own burning meat and the searing, unimaginable pain was a final part of the cure. And your chances of survival? Almost zero. If you didn't die from the shock and the pain on the table, you would almost certainly die from the massive infection known as laudable pus that would set in a few days later. The medieval operating theater was not a place of healing. It was a place of last resort. It was a butcher's shop, and you were the meat. Perhaps the most terrifying and bizarre of all medieval surgical procedures was trepanation. This was a practice of drilling, cutting, or scraping a hole into the human skull. Why would they do this? They believed that mental illness, epilepsy, and even severe headaches were caused by evil spirits or demons trapped inside your head. The hole, they reasoned, was an exit door. It would allow the evil spirit to escape, thus curing you. The surgeon would use a crude, hand-cranked drill called a trepanation to bore through the bone of your skull while you were, again, wide awake. The risk of drilling too deep and puncturing the brain itself was immense. The risk of infection was a certainty. Archaeologists have found skulls from this period with multiple trepanation holes, suggesting that some people, unbelievably, survived this procedure, only to have it performed on them again. Imagine the psychological terror of knowing that the cure for your seizures was to have a man with a hand drill bore a hole into your living skull. If you managed to avoid the surgeon's knife, you were not safe. The medicines prescribed by medieval doctors were a grotesque and deadly cocktail of poison, animal feces, and pure superstition. They practiced what was called sympathetic magic. They believed that you could cure an ailment by consuming something that resembled it. So, for jaundice, which turns the skin yellow, they would prescribe a lovely drink made from saffron, turmeric, and goose dung. Got a cut? Forget antiseptic. They would pack the wound with a plaster made of animal dung, believing its drying properties would help. Of course, this was a direct injection of tetanus and other deadly bacteria. One of the most prized ingredients in the medieval pharmacy was mummy powder. This was literally ground up ancient Egyptian mummies, which were looted from tombs and shipped to Europe. Doctors would prescribe this dust for everything from headaches to stomach ulcers. You could be prescribed a dose of a 3,000-year-old pharaoh to cure your cough. And then there were the poisons. Mercury, lead, and arsenic were common ingredients. Doctors believed these toxic heavy metals would purge the body of disease. And they did. They would purge the body of life itself, causing kidney failure, nerve damage, and a slow, agonizing death. Often, the richest patient got the worst care because they were the only ones who could afford these expensive, poisonous cures. So what was medieval medicine? It was a perfect storm of absolute confidence, profound ignorance. It was a system where the cure was consistently more deadly than the disease. It was a world where doctors, with the very best of intentions, tortured, poisoned, and bled their patients to death. It is a chilling and humbling reminder of the terrifying power of a bad idea. For 1,000 years, the wrong theory held the entire continent hostage, turning what should have been a practice of healing into a ritual of suffering. The next time you take a simple antibiotic, the next time you get a shot of Novocaine at the dentist, remember this story. Remember the screaming runes, the poison cures, and the astrological bleeding charts. Because the greatest miracle of modern medicine is not the complex surgery or the wonder drug. It is a simple fact that we have escaped the horrifying medical torture of the Middle Ages.